So first, we work on the pelvic and the sacral joints. I'm going to utilize our spine model here to kind of create a little bit of an illustration, but here is the lumbar spine, and here we have your pelvis. Now, if we look at the back here, you have two major wings of the pelvis, and then you have the tailbone in the middle here. Now, the adjustments that we do in practice are following a predictive model of assessing the Webster side. So that's using a leg tension test sign to actually figure out what part of the sacrum and tailbone is kind of rocked up and out of place. And then that usually is going to mean that the opposite pelvis is also going to be up. And so it kind of creates like this crinkled pattern. Now, the adjustments are really soft and controlled. We use a drop piece that's on the chiropractic table and make contacts that are on the tailbone and on the pelvis to address those. Now, one, by fixing the alignment at the pelvis, that hopefully does take some of the pain and tension off the nerves and off all the other tissues in the area to help control that low back pain. But the other nice little bonus is we need to understand a little bit more about our anatomy down here. And by ours, I mean female anatomy. We're going to use the Frank Netter's Atlas here. And on this page, I actually want to create an illustration and understanding that the uterus is actually attached to the pelvis in 6 different spots. We have this first little stretch right here. This is called the round ligament. That goes and attaches to the front part of the pelvis. Then out to the side here is what we call the broad ligament that attaches to the side of the pelvis. And then this illustration kind of does a better job because you can't really see back behind that first one, but there's fibers that go off the back that are called the uterosacral ligament, and those are going to attach to the back of the pelvis. So then if you can imagine in our model here, we've got 2 ligaments attaching here, 2 ligaments that attach to the side, and 2 ligaments that attach to the very front of that tailbone. So by addressing the alignment at the pelvic and sacral joints, we could actually take unnecessary torque, strain, and pressure off of the uterus itself. And that is what's hopefully may give us a chance in reducing a difficulty labor later on.